opportunity to be with you. I just came from our students getting ready for commencement. We were passing out their cap and gowns, and I was, we had DJs, and we had all kinds of things all over campus, and so the only thing that could have torn me away from that, Joan, was you and the opportunity to be here and to share with you about such an unbelievable topic, but also just to be among all of you who are having discussions like this over how many days are you doing this, Joan? 2 days of just getting into conversations that matter. I want to thank you for this kind invitation to address this wonderful gathering that reflects the rising leadership in the medical, research, and the policy communities. I'm humbled by your invitation as usual. Thank you for that. I'm honored to be able in some small way to be here. And, that guy sitting over there, he's kind of nervous. Because, see, you all gave me the opportunity to walk around and talk and say whatever I'd like to say today. And this gentleman is here to make sure I don't do none of that. He would hope that I would come here and be okay because Joan is here. He doesn't know we've been doing this for over 3 decades. When you get over that, you start talking about decades instead of years. And here we are still doing this. So when you talk about doing a workshop and you have to do it 7 times before it sticks, please, this is a lifetime endeavor. And you cannot get thrown off by all of the obstacles that are in your way, some seen and unseen. I was sitting around this morning and someone asked me about what happens when you sort of go through what some of us go through every day. This person happened to walk in the store with me and in this wonderful suit, because I think I look pretty good today. I was being followed around that store. And that person was upset. And I tried to explain to him that I'm kind of used to that. I don't like it. But I just make them walk. And we walk, and sometimes I'll buy, and sometimes I'll fly. It depends on, how I feel that day. So it's an amazing, amazing opportunity to be with you. I'm particularly pleased to see there's been a focus on diversity in education here today. I want to thank Dr. Joan Reed. Thank you just for being you. You have so many titles and so many things that you do. Your commitment is unbelievable. So grateful to you. I am honored to be a part of your great work. You include me in everything. See, Harvard has it like that. I'm from a public university here in the city. But she makes sure that I'm always included. I've been mediating, or I'm not mediating, I would say moderating. Some people might have thought I was mediating conversations between national groups of you, the National Medical Association, the national this in healthcare, the national that, because she made that possible. What an unbelievable experience. So you've always provided an opportunity for me. This, for me, is a tune-up. It's an opportunity to come over and hang out with you and sort of get from you. Dr. Asai, I'm so glad I walked in on your conversation. Thank you. Thank you for always being you. This is new. The consistency I love. Whenever you're somewhere and we have a chance to listen to you, thank you. So I'm so grateful for that. I would also want to say to the dean, even though I know the dean is probably not here today, I want to thank the dean for allowing this opportunity. That person is responsible for this, and as someone who leads an entity, I want to say thank you for the grace and hospitality in letting me come onto this campus today. I bring greetings on behalf of this Commonwealth's capital city, student-centered urban public research university, the University of Massachusetts, Boston. I'm so glad that our public mission allows me to just be who I am. It gives me the excuse to sort of tamper in everything. If there's an issue that is relevant publicly, we were talking about the unrest on some of the campuses that's happening all over the country, I have the excuse of sort of putting my toes in it. And you can see I wear about a 16 or 17 on a good day. You know, when my feet don't hurt and I have to take Tylenol or something, some of y'all know what I'm talking about. You know, I can put and immerse myself in those things, and that's an amazing, amazing thing. And so I come here with all of you, and I'm so grateful that I don't have to talk about all the things that I heard the doctor talk about, all these kind of antibodies and all this and that. You guys already talk about that. I'm also grateful that when I hear you as public intellectuals, that you don't just share your work in the kind of journals that only you would want to read. You put it in things that I read and I can have some takeaways from. Thank you for that. You know, it allows for us to sort of sort out and haze through some of the political rhetoric. It allows for us to sort of get through some of the incomplete journalism, to sort out the complex issues associated with our healthcare experience in this nation. And I'm so grateful that you do that as public intellectuals. And I look over this audience and I'm reminded of the storied history of this august institution. I'm grateful that its very founding is caught up with the introduction of the smallpox vaccine in the very young United States of America. I'm also grateful that within his first century of existence, that Charles Eliot led the charge to change the landscape for medical education and set a new standard for the organization of medical schools in this country and in universities. I'm grateful for the many Nobel laureates that have walked these halls in their groundbreaking research, which continues to move the medical discipline and profession forward. I'm grateful because I know that there is a direct link between that wonderful, competent, professional health care I am receiving now in my middle years of my life and the history of Harvard Medical School. Over the centuries, this institution has presented many gifts to generations unborn at the time of the giving, and I have no doubt that it will continue to do so in centuries to come. I'm happy to know that a Harvard Medical School education includes the inculcation of values that teach us never to forget our commitment to community. I know that because she's here. I know that because many of my colleagues are here. One of the elders whom I've looked up over the years, Dr. Edgar Smith, the first African-American vice president of a system that I sort of knew back when I was developing. Dr. Smith is a scientist, and he's someone who served at Boston University Medical School. I can say that here, right? At Harvard, I could talk about other places. Okay, thanks, Joe. He was at Boston University Medical School. He was at the University of Massachusetts Medical School, but he also was a vice president for that entire system. And he's worked and he developed community hospitals in Mississippi because he promised his grandparents that once he got a degree, he would do that. He insisted that commitment to one's community must be a bedrock value upon which one's education rests, particularly in medical education. These are values that have maintained communities of color through its most difficult historical periods. And I truly believe that it's the only way that we will maintain all of our communities into the future. Doc would also come in on Saturdays. We have a program for young people because we believe that it begins very early. So back in about 1989, we started a supplemental education program. And that was to teach young people that school was okay, but we had to make it relevant for them. So we came to Harvard, and we came to this young lady. And we said, listen, we have found that in the schools, they don't teach science at those levels. So Dr. Smith, this medical giant, this researcher, began to teach these third grade and fourth grade and fifth grade boys now who have all gone on to medical school and other kinds of professions in healthcare, science, on Saturdays as part of the Paul Robeson Institute for Positive Self-Development. We named it after Paul Robeson because at that time he was their Michael Jordan or LeBron James. He was their Denzel Washington. He was their scholar. Rutgers still hasn't got sense enough to honor him as their greatest graduate in their history. Law degree, actor. So we said these children need to see that. So Doc's teaching. But here's the kicker. We came to Harvard. We said we need to have a fifth grade anatomy class. So we set up in the Harvard Medical School through a young lady. She got the African American entrance first-year students to come in and learn about us. Second-year students to sort of run fifth grade anatomy. I have to say, I don't know how they showed up, but fetal pigs started showing up, and we started using air pumps to show them how the body worked. We used gloves. I don't know how the brains showed up, but they were in buckets. They showed up. Kids learned about, the stems of the brain. We're learning because it's an intergenerational opportunity to learn about stuff. Exposure is the greatest thing, as you know, that can happen. And if it starts young, you end up at Harvard or the University of Massachusetts, Boston. So Doc understood that. But see, Doc had values. So I show up to a Harvard teaching hospital, and my wife's in labor. And so I get hungry. I leave her, she's with the doctor that I think she's going to be with. And I think I have all these values, teaching, exposure, all this stuff that I talk to you about. I go downstairs. I got my feet up in the cafeteria. I come back in the room, and I hear someone telling me, after I've had my chicken wings and fries and stuff, that she's crowning. But then I hear a voice say, yeah, man, she's crowning. And I look, and it's one of those students that have been teaching. So my values was tested. I said, hold up. My man, I know you're not in here with Mrs. Motley with her legs out like this, crowning. But Dr. Motley, you talked about all those values and all that. I'm like, man, you better take your value-driven butt out. Now he's one of the finest physicians in this country. But even all of us who have all these values about what we think we want to do, sometimes we even suffer from this psychologically affected self-concept. We get all messed up in the head because somebody followed you around the store. Because somebody walked in your office who you know can't carry your bag in a laboratory. Couldn't teach if you gave them T, E, A, C, H, and spotted them the E and an R, right? But yet wants to make you feel like you're the challenge. So we have adjustment problems. So here I am, how you know something's a core value, as you know, you sort of say it. Then you're supposed to organize for it. Then when you see it being jacked up, like Doc was saying, you're supposed to sort of figure out a way to let folks know or teach them that that's not too cool. So I got caught up in my core values were jacked up when my man was in there with Mrs. Motley. So it happens to all of us. So when it happens to you, just readjust. I readjusted. I walked him out the room. I hugged him. I told him, you're going to be a fine doctor, but you're just not going to be a fine doctor today. When this is over, I'm going home with her. She saw you on Saturdays teaching anatomy when she picked me up. Doctor? So anyway, sorry, Steve. But listen, I say all that to say that we just need to believe that what we are doing matters. The efforts that we put into teaching others and learning, but modeling it matters. You know, I could have modeled it a little different, but that was 2000. I'm a whole lot different in 2016 at how I would have handled that than in 2000. Then ego gets all in the way, you know, all those things that you don't think through. You know, the ego sometimes it drives you to say or want to say or act in ways that you know are not what you've been told to do or shown or exampled to do by those who came before you. So we're proud for a few things. Let me just tell you a little bit about what we're proud of at the University of Massachusetts. One is that we're Carnegie Foundation's engaged institution throughout all of our campuses. In 2012, we were recognized by NIH, National Institute on Minority Health and Health Disparities within the United States Department of Health and Human Services as a comprehensive center for excellence and awarded $7 million over 5 years to establish the University of Massachusetts Center for Health Equity Intervention. That's with our University of Massachusetts Medical School. See, they suffer from a complex sometimes with me too, as my colleagues, because I'm in Boston. So I'm hanging out down here on Longwood Avenue. See, I have a relationship, a long-standing partnership right with Dana-Farber, Harvard Health Center. And it's a U56 and a U54 NIH grant to collaborate on research aimed at addressing issues of cancer in disenfranchised populations. All of our work is about the disparities that you're talking about as you journey through this celebration of learning and sharing over the next couple days. That's our focus. As a public university, my mental model is that. And as a leader, I'm so grateful for that. Allowing our students and faculty to work and do research from people within and from underserved communities through the opening of our joint personalized cancer center on campus has been a tremendous thing. I'm also glad to be among those educators who believe that our higher education institution must serve and lead where the battle is. You don't run away from battles in this room. I know you don't. I'm looking around, I'm seeing who's here. You run to the battle. You know, there are some folks, run as soon as they can from this battle. Oh, I don't do that anymore. I'm not going to be stigmatized like that. Stigmatized? When you were my student, you told me that you were doing this so you could go back and, you know, not only demonstrate to others that, you know, you could, but also help those communities that you, So I'm very happy to know that I stand today in the midst of like-minded leaders and within the halls of a like-minded institution. So, Chancellor, why are you here at Harvard Medical School talking diversity in healthcare to faculty, future doctors, researchers, and policymakers? What brings the Chancellor of the University of Massachusetts, Boston, an urban public research university, to the Longwood Avenue Quad to speak to the students, faculty, administrators, and other healthcare professionals of one of America's foremost medical schools? I'm here because I know that we all very much need to be engaged in the same endeavors around the health of our communities. We may use different methodologies, but it is the same concern. For many reasons that I don't have time to go into, many people don't think health disparities or inequities are a civil rights issue. You know, we saw that current quote from our justice. She's going to be here Saturday down the street at Wheelock speaking. But in 1966, Dr. Martin Luther King declared that of all of the forms of inequality, injustice in healthcare is the most shocking and inhumane that you can have. And so I know at Harvard, You already know all the statistics, but I just want you to know that I know that you know that I know. That you know. The U.S. healthcare system ranks 37th among 190 nations. Sad. Roughly $3 trillion spent on healthcare. Health outcomes in our population are lower than other countries, and it makes you feel like, oh my God, ranking 26th for life expectancy, something that becomes more important to a brother like me every day. I come up here, sometimes I'm that dude you see standing outside watching you and applauding because I'm waiting for your discoveries. Thank you. Life expectancy is a pretty big deal. So thank you. So when I hear that I need to go to the United Kingdom, Switzerland, Denmark, Slovenia to live longer, oh my God. According to 2014 National Healthcare Quality and Disparities Report, across a broad spectrum of healthcare access measures through 2012, there were some reductions in disparities in care experienced by racial, ethnic minorities, and poor people, thanks to the Affordable Health Care Act, but most did not improve. Cardiovascular disease is the leading cause of death in the United States. Among non-Hispanic Black adults, 50% are more likely to die of heart disease. The prevalence of adult diabetes, I don't have to tell you about that. Among Hispanics, Blacks, and others of mixed races, tragedy. Prevalence is also higher among adults with college degrees, which is pretty interesting to me. Get a college degree, you get diabetes? Come on, Joan. The infant mortality rate. All those things I read that you guys put in the newspaper for me. Men are far more likely to commit suicide than women. I knew y'all were smart. But oh my goodness, what a sad thing for us. And so, regardless of race or age or ethnicity, 4 times those of women. It's what they say about men. You say about that. This is things that you guys have read. For both men and women, suicide rates are highest among American Indians, Alaskan Natives, and non-Hispanic whites. And so I'm here in part to say thank you, to encourage you, to affirm what you already do, and what you are engaged in as students, faculty, researchers, and policymakers. In this regard, our society needs you to keep your foot on the accelerator. We cannot take our feet off the accelerator now. I work closely with the Coalition of Urban Serving Universities, and they focus their attention on enhancing and expanding a culturally sensitive, diverse, and prepared health workforce that will improve health and reduce health disparities in urban communities. And it's clear to me that our work and that your work here is critical to addressing our national challenge. I know you see yourselves as looking out into the world, and we're so grateful for that. Your core commitments to innovation in education, scientific discovery and integrity, diversity, professional development like you're going through today, and service to humanity is something that keeps you in the vanguard of relevant and engaged medical education and research in our Commonwealth, our nation, and the world. Your extraordinary reputation is about more than money and resources. Believe me, I know too well that money and resources matter. Though it's about accomplished faculty, it's more than that. It's more than about accomplished administrators, though that helps. It's even more than recruiting the best, most accomplished students and others who come to this institution. Rather, it's about your commitment at all levels of your institution to live out the values that guide you into excellence. Without that commitment, an organization's efforts dissipate because this work in which we are engaged is difficult and it is taxing. Having led a major university for over 10 years and having been in this field for over 3 decades, I recognize that for every institution to remain relevant, it must constantly reflect and reassess itself to ensure that it's hitting the bull's eye of excellence. Ordinary, as you know, or mediocre is officially over, as they say. And that goes for colleges and universities too. An elder once told me that when I was complaining as a youngster about working too hard, he pulled me aside. He said, "Hey, son, there's really no point in doing well, which you should not be doing anyway. So why are you working so hard at that? You shouldn't be doing it anyway." My thing is, as service institutions, we must always recognize that we are in a relationship with a dynamic society that is always changing and developing new expectations. Even at places like Harvard, we can't do the same thing all of the time. We have to have these kinds of conversations because things are changing. Our students are changing. Someone said, do we wait for our faculty to change before we try to change our culture as an institution? We can't wait for that. People change sometimes. They may not even tell you that they've made some kind of transition. They sort of demonstrate that for you. And it'll amaze you what just some of the work that you've been going through all day will help institutions sort of come to fruition about. As you undertake the task for which you are being educated, I encourage you to always have this notion of a psychologically effective self-concept. Lose your mind with confidence that leads you to become a psychotic optimist, confident and expecting the best. But always be aware that a new approach, a new treatment, multiple treatments may be necessary. Have an artisan's temperament. Yes, I know that you know the 4 temperaments of Greek medicine and all that they teach here, but deal with each scenario individually. Bring your unique value to it, put your signature on it, and be able to take pride in all that you do. Always, as they say, be in beta mode, or always be looking for new discoveries or new answers. Test for imperfections. Retool and re-engineer constantly. What does it mean for healthcare if 60%, like someone told me, of the next decade's best opportunities haven't even been thought of yet? So what does that mean? How should we be changing? 60% of the things that are going to happen just a few years from now, no one's even thought about it. So what impact does it have for even folk who were educating and being educated and going out in healthcare from here or the other institutions that you represent? I know that you know here that intelligence without passion and curiosity is empty. Intelligence is important, but needs curiosity and passion for sustained excellence. If you don't care or lack a fire in your belly, your intelligence may not motivate you to push to your goals. You need these qualities in equal parts to make the difference you're pursuing. Someone always tells you to think entrepreneurially or reframe your thinking to know where always the challenge is, and then to always be asking, where is there a new opportunity? But see the elements of diversity as innovation opportunities. What is the opportunity for innovation that comes and sort of percolates up from all of this great diversity you're talking about? Then use it as a strength. The great danger for our institutions and for each of us as individuals is to simply slip mindlessly into routine mode and not use the gift of our minds to remain reflective on our practice so that we grow and develop to meet the needs of our ever-changing world. I'm also here because as educators, we're all allies in this great struggle. One of my mentors who was in these halls for a long time, Dr. Augustus White, a distinguished member of your faculty, during an interview about his book, Seeing Patients, was asked about how to deal with the unconscious bias that is revealed to be so prevalent, a bias that is believed to contribute to the health disparities we face today. He replied in part by saying, education, education, education. It requires a lot of attention. It requires a reorientation of thinking in terms of knowing how to effectively use interpreters and how to effectively use knowledge of other cultures other than the mainstream Eurocentric American culture, and how to use that in a way that benefits the patient without stereotyping the patient. Dr. Smith and Dr. White regard education as critical to helping caregivers become reflective on their own biases, like I was talking about my own bias early on, so as to disarm the tendency to marginalize or disregard some as opposed to others. I see that education plays a role in changing not only the caregiver, but also the care recipient. And so the research community has become acutely aware that the factors that influence the socioeconomic position of individuals and groups within industrial societies also influence their health. In the U.S., educational attainment and income are the indicators that are most commonly used to measure the effect of socioeconomic positions on health and statistics, and show that educational attainment generally leads to a higher income over the course of an individual's life. In 2013, the Robert Wood Johnson Foundation found that persons with low levels of education and income generally experience increased rates of mortality, morbidity, and also risk-taking behaviors, and decreased access to and quality of health care. Furthermore, they report that the lowest levels of education and income are most common and persistent among subgroups that systemically exhibit the poorest health. So as educators, and particularly as educators of diverse populations, we're doing battle against these health disparities. On our campuses, we often loosely utilize rhetoric about transformational experiences of higher education, but here there appears to be some evidence that it's more than rhetoric, and that a changed consciousness and set of behaviors actually is going to be ensued. And so educational attainment provides psychosocial and material resources that protect against exposure to health risks. Here are some realities about the relationship of education to health that we know. First, education can lead to improved health by increasing health knowledge and healthy behaviors. When you know better, sometimes you can do better. And knowing better is a key goal of education. Second, greater educational attainment leads to better employment opportunities, as we know, and higher income is linked to better health. A good education results in better jobs that afford access to good health insurance. For most of us, health insurance is the foundation for better health practices. We're nudged, we're nudged, we're nudged. And then at the end, we hope preventative and healthy behaviors persist. Lastly, education is linked with social and psychological factors that affect health. Greater education leads to beliefs about one's ability to control one's life and one's destiny. It sort of soups you up to be over here at Harvard. All you have to do sometimes is just say, Harvard. And that sort of ends lots of conversations. But it's more than that. It helps us to be confident, but we must also be caring in our healthcare institutions. And so educational attainment also influences social networks and peer groups. Better health, behavior, and knowledge are often learned and shared within social networks. So at the end of the day, fulfilling the promise of real educational access is more than raising the collective intellectual capacity of a nation. It's about more than providing a competent workplace for the knowledge economy. It's about more than creating a competitive advantage for our institution, our state, or our nation. It's about our collective health. It's about reducing disparities and inequalities in health based on socioeconomic factors, which continues to cast a moral dark cloud over our democracy and a strain on our economy. It's about opening the door of opportunity to the good life, that is too often decided and denied to the people of our communities for arbitrary reasons. It's about extending life and increasing the quality of life for more people in our society. This critical nexus, this junction of healthcare, diversity, and education is a volatile space where social justice, fairness, and compassion encounter complex economic realities, long-standing systemic and institutional biases, and divisive political rhetoric and commitments. Our soaring visions of universal access to health and education must time again pass over the uneven potholed terrain of our democracy and the winding and uncertain road to policy creation. That way is hard, and that way is demanding, but it leads to a better world that we implicitly seek when we look and take on these daunting tasks. So I, for one, am proud to be engaged with you in this struggle, and with you, such noble ends and outcomes I know are on their way. I know that for the most of you in this room, the journey you've chosen is often grueling. Some of us have been in it for a long time. Some of us are entering it. It's full of long days and sleep-deprived nights, but it's a pathway leading through transformed lives to transform communities. I exhort you today to not grow weary in doing well, for in due season, you really reap a harvest of joy, a harvest of abundance, a harvest of soul, satisfaction, and contentment, because you will have served well. And so thank you for the opportunity for me to come before you today, to have this tune-up with you. I'm looking forward to any exchange if we have time for questions at all, or are we moving forward?